Hi, I'm Carol Andrews for another episode of Southwest TV News. Here are some of the stories we've been working on for today's show. 25-year-old Jerry Chu made another appearance before the judge on Monday, once again via video conference from Regina remand. Saskatchewan has had the highest teen smoking rate in Canada for 10 years in a row, and the Canadian Cancer Society is hoping to convince youth to kick the habit. As more cases of measles are being diagnosed in Saskatchewan, health officials are stressing the importance of keeping one's vaccinations up to date. Thanks for joining us here today. A Herbert man remains in jail as his case for second-degree murder charges continues through the Swift Current Provincial Court system. We have more in today's top story. A Herbert murder case continues to make the Swift Current Provincial Court docket. 25-year-old Jerry Chu made another appearance before the judge on Monday, once again via video conference from Regina remand. Upon discussion between Judge Matsela, the Crown Prosecutor, and the defense lawyer via telephone from Vancouver, a management pretrial is now set for April 25th, with a preliminary inquiry for the week of June 23rd. The accused, Jerry Chu, will remain in custody until further notice, with no request for bail made at this point in time by his legal counsel. Chu was arrested back in mid-September for the second-degree murder of Henry Jin, also a resident of Herbert. Jin's body was located in a ditch south of Morse after being reported missing by family and friends. Jerry Chu is the lone suspect in the case and has been in custody since his arrest in September. Putting a ban on flavored tobacco products in Saskatchewan is the latest focus for the Canadian Cancer Society. We have more in this report. Saskatchewan has had the highest teen smoking rate in Canada for 10 years in a row, and the Canadian Cancer Society is hoping to convince youth to kick the habit and get the provincial government to ban flavored tobacco products in Saskatchewan. Back in December, an Ipsos Reid poll surveyed 516 Saskatchewan residents, and once the data was tallied, 81% of those residents support legislation to ban fruit and candy-flavored tobacco, including 63% of smokers. Overall data, which the Canadian Cancer Society is hoping will attract the attention of the provincial government.
And I guess what really alarmed us was a study that was released in October by the University of Waterloo. The Youth Smoking Survey showed that more than half of teen tobacco users across Canada had tried one of these flavored products, and suggesting to us that the packaging, the kid-friendly packaging, and the flavors are very enticing to young people. So Alberta has banned these products already. Ontario has introduced legislation, and given our extraordinarily high youth smoking rates, we would like to see these products removed from our shelves as well.
Saskatchewan's health minister says he's aware of the Canadian Cancer Society's concerns through numerous consultations with the organization, and says the province is looking at ways to address the issue.
We're also looking at other jurisdictions around the packaging of tobacco. So Australia a couple of years ago went as far as removing the ability for tobacco companies to be able to use colors in their, not only their advertising, but in fact in the packaging. So they've gone to plain packaging. So that's something that we are looking at as well. So we'll continue to work with the Cancer Society and try to move some of these issues forward. But at this point, we don't have any plans to move on a full flavor ban.
According to stats from the Canadian Cancer Society, 20% of 15 to 19-year-olds in Saskatchewan smoke, compared to 11% nationally.
Well, I don't think we're doing enough. We have not invested in tobacco control programs as other provinces have done. Just to give you an example, we are expected to bring in $245 million this year in tobacco tax revenue. We will spend about $500,000 on tobacco reduction programs. That's simply not good enough. And on the policy end, this flavored tobacco piece is just one of a number of measures that we could implement to reduce tobacco use. We could increase the prices even more. We could reduce where tobacco is allowed to be sold. We could ban smoking on outdoor patios of restaurants and bars, as Saskatchewan has done, to further reduce exposure to secondhand smoke and further denormalize tobacco use.
The Canadian Cancer Society is encouraging more feedback from the public on the flavored tobacco issue, now and beyond National Non-Smoking Week, by logging on to their website. Well, are your vaccinations up to date? This is the question Saskatchewan health officials are asking as more measles cases are popping up across the province. As more cases of measles are being diagnosed in Saskatchewan, health officials are stressing the importance of keeping one's vaccinations up to date. Measles is a highly contagious illness that is easily transmitted through the air. Symptoms include high fever, cough, and runny nose, followed by a rash. The rash usually starts on the face before spreading to the rest of the body, and the symptoms generally occur approximately 1 week following exposure. Here in Saskatchewan, measles are not generally big news, and there's one key reason why.
That's right. Because of the good coverage rates, we are not seeing things like measles. We don't see polio, and yet there are jurisdictions across the world where their immunization rates are poor, and they are actually dealing with cases.
Dr. Tor adds that vaccinations for children begin at the age of 2 months and continue onward with a series of booster shots. And if you were born before 1970, you are likely covered by all of your childhood vaccinations. He also stresses the vaccinations should continue through adulthood.
Even for adults, things like tetanus and diphtheria are important boosters to keep in mind. And of course, the other thing is that we do travel outside to some of these jurisdictions, and it's always important before you travel to make sure you're up to date with the immunizations you have. And sometimes you might need special medication for prevention of illnesses in the jurisdiction you're going to, or special immunizations for diseases that are occurring in those areas you're traveling to.
If you or a loved one develop measles symptoms, you're advised to call your physician's office in advance of arriving in person, therefore allowing the clinic to minimize the risk of spreading the illness to others. Further details on vaccinations are available from your physician or local public health office. Well, this brings to a close another episode of Southwest TV News, reporting the stories that matter to you. We always welcome your news tips. You can always reach us here by phone at our studio or by email to contact us at southwesttvnews.com. Also, be sure to join us daily online for the latest news from across Southwest Saskatchewan and so much more at mylocaltv.ca. And be sure to follow us on Facebook, Twitter, and Pinterest. Thanks for joining us here today. I'm Carol Andrews.